So for the PEACE-1 trial, it was a trial with 4 arms of treatment, with standard of care with or without abiraterone and with or without prostate radiotherapy. The results have been extensively reported already, but mainly there have been a benefit in overall survival with the addition of abiraterone to castration and docetaxel, as well as in rPFS, of course. So in the PEACE-1 trial, the design was 4 arms of treatment with abiraterone added to standard of care and more or less radiotherapy to the prostate. And the results have been extensively reported with a benefit in rPFS and overall survival for the addition of abiraterone to castration and docetaxel. So the triplet treatment do better in this patient. What we presented at ESMO 2024 is the ancillary study for the PEACE-1 trial, the very first result we present. The hypothesis for the study is that there is probably some aggressive variants or neuroendocrine-like variants that could be detected at diagnosis and associated with outcomes. Well, what we found in this trial, we performed immunohistochemistry staining for 400 patients in this ancillary study. And what we found is that based on phenotypes definition with 5 phenotypes, we had different outcomes for these patients with only 3 patients for a double negative tumor, so it's hard to draw conclusion on them. But 5 patients had neuroendocrine phenotype with higher negative and neuroendocrine positive markers in staining. And this patient had clearly shorter overall survival, but with only 5 patients, so it's limiting the conclusion as well. And when we look at the bulk of all the phenotypes, we had higher low and higher high patients having a similar overall survival, whereas the amphicrine patients had a slightly shorter overall survival. Amphicrine phenotype was defined by higher positive and neuroendocrine positive marker. And when we look at the same phenotypic and immunochemistry data for these patients, when focusing on each marker, we saw that negative patients had clearly a worse outcome as expected, with only 10 patients in this group. Patients having synaptophysin and chromogranin A marker positivity had also a worse prognosis. And surprisingly, and most importantly, we found that large number of patients, almost 1/4 of these patients with immunochemistry staining contributive, where they had at least one marker, neuroendocrine marker positive among synaptophysin, chromogranin A, and CD56. And these patients with all these marker positive had a worse outcome, a worse prognosis. And also it is important to note that apart from all this prognostics value we found, we didn't add any biomarker to predict abiraterone benefits for these patients. So that means that all the patients in PEACE-1 benefit from abiraterone regardless of all these immunochemistry markers.